Asthma talk at number 10. What about actually the longer term plan with asthma? How do we, obviously, we want to stop people having acute asthma attacks, but how do we stop people, even if we stop them having acute asthma attacks, how do we stop them having long term effects on their health? How do we control the asthma in the longer term? Perhaps the most important thing is to take the medication that you've been prescribed by your doctor in the correct way. So be aware of what the different inhalers are for. If you're not clear, then ask somebody at the GP practice or at the hospital, what are these different inhalers for? How do I use them? Make sure that you don't run out of inhaler. So inhalers feel different when you shake them if they're nearly empty compared to when they're full. Always have a supply, particularly of the blue inhaler in the house, because that's the one particularly that can be life-saving, but also don't forget the other ones as well, the longer term control, because running out of those for a few days may also make a person poorly. Keep an eye on any other medications that the person is being prescribed, because some medications can interfere with their asthma, particularly common ones like ibuprofen and anti-inflammatory medications which people take for aches and pains and coughs and colds, but also things like aspirin. The second way that the person can manage their asthma is to keep healthy, keep their body weight to a sensible level. If they're overweight, try and lose weight. Exercise regularly. Um, People get worried about exercising because they find that exercise can sometimes trigger off an asthma attack, but to be honest, once a patient's asthma is well controlled on the correct treatment, we tend to find that the exercise, if anything, is helpful rather than a problem for their asthma. Um, a few safety tips though. A person should always tell people that what exercise they're going to be doing if they have asthma, where they're going to be going, um, and just in case they need to contact somebody, they need to have a mobile phone or some means of contacting them if they're going to be exercising alone. Obviously, if they're exercising with somebody else, then the person can make sure their exercise is not making their asthma worse. The person who they exercise with should be aware of what to do if the patient has an asthma attack. The person who's exercising who has asthma should always keep their reliever inhaler with them, their blue inhaler with them. It's a sensible idea to give, if it's particularly if it's going to be strenuous exercise, but any kind of exercise really, to use the reliever inhaler before starting to warm up and get ready for their exercise, and warm up and warm down thoroughly. And if a person gets asthma symptoms whilst they're exercising, then they need to stop what they're doing, take a break, take the blue inhaler, and wait till the breathing has settled down again. Aerobic exercise is very important to do to keep the lungs healthy. Eating healthily is also a way of helping to control asthma. Asthma doesn't require a special diet, but patients may find that if they have particular identified food allergies that they know from experience trigger off their symptoms, then it's best to avoid them, obviously. And in general, it's a good idea to know what sort of things will trigger off the asthma, and a patient often finds those out by trial and error. Another important aspect of asthma control is to stop smoking or to stay away from areas where people are smoking. Um, if a person has asthma and is a smoker, then stopping smoking can significantly reduce the amount of flare-ups the person has, and also how how poorly controlled their asthma is in the longer term. Um, Other general health things, as well as eating healthily and maintaining a sensible body weight, include things like getting an appropriate vaccinations. So everyone who has asthma in the UK is encouraged to have their flu jab and their pneumococcal vaccinations, a flu jab every year, and the pneumococcus or the pneumonia injection as a one-off. Um, and the last thing to mention is about getting a good night's sleep. Asthma symptoms, when they play up, often play people up at night, and particularly in children. In the case of children, if it affects their sleep, then that can affect them during the day, their education, their behaviour, their concentration. So keep an eye out on the patient's sleep patterns is a good idea in general, but also it can be a good idea in terms of telling doctors how well controlled a person's asthma is.